Good morning to all those who make this broadcast possible, to Pepe Mejia, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of 2 people with COVID-19 yesterday. The first was a 68-year-old man from Ciego de Ávila and the municipality of the same name. He suffered from some pre-existing health conditions and was admitted to hospital on August the 17th. Due to his condition, the patient was transferred to the intensive care unit. The patient experienced a series of complications and on September the 26th suffered cardiorespiratory arrest, from which he could not be revived. We offer our condolences to his family and friends. The other patient was a 48-year-old woman, also from Ciego de Ávila. She was a confirmed case contact and suffering from a pre-existing illness. On September the 21st, the patient began to experience shortness of breath, which continued to worsen. She was admitted to hospital and transferred to the intensive care unit. On September the 25th, she went into cardiorespiratory arrest. At that time, it was possible to revive her. However, yesterday, she suffered another attack from which she could not be revived. We offer our condolences to her friends and family. Today, 8,285 people are hospitalized in Cuba. 6,370 are under observation. There are 1,333 suspected cases and 582 confirmed active cases. Yesterday, once again, we processed over 7,000 samples, 7,027, in our various molecular biology laboratories. 2,306 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 906 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 900 in Havana's, 412 in Santiago de Cuba's, 470 in the Genetic Engineering and Biotechnology Center Lab, 418 in the Hermanos Almaheira's Hospital, 364 in the Manuel Fajardo Hospital, 330 in the ICA laboratories, 309 in the Civil Defense Laboratories, 308 in the Fructuoso Rodriguez Hospital, 176 in the National Center for Genetics, 101 in the Naval Hospital, and 27 in the Molecular Immunology Center. Of the 7,027 samples processed, 45 tested positive for COVID-19. That's 45 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 591,921, of which 5,457, or 0.92% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. From Pinar del Rio, 107, Havana, 1,747, Mayabeque, 178, Matanzas, 1,245, Cienfuegos, 107, Villa Clara, 195, Sancti Spiritus, 94, Camagüey, 219, Ciego de Ávila, 1,216, Las Tunas, 134, Holguín, 426, Santiago de Cuba, 91, Guantanamo 110, and so on and so forth from all of the country's territories. All of the 45 positive cases diagnosed yesterday are Cubans. 42 or 93.3% of the 45 positive cases yesterday are confirmed case contacts. This means that 90.7% of all cases on the island since the pandemic began have had contact with someone who previously tested positive for the virus. Of the 45 cases diagnosed yesterday, the source of infection linked to 3 is yet to be determined. The source of infection in 68 cases reported over the last 15 days is therefore still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 441. Of the 45 diagnosed cases yesterday, 28 are male, for 50.7% of all cases on the island, and 17 are female, representing 49.3% of all diagnosed cases. 32, or 71.1%, of the 45 cases yesterday were asymptomatic at the time of testing. Overall, 60.4% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing. This figure rises to 70.5% of cases over the last 15 days. By age group, 6 positive cases diagnosed yesterday are under the age of 20. All of these are in fact under 18 years of age, for a total of 597 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 511, or 85.6%, have recovered from the virus and been discharged from hospital. Meanwhile, 24 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 13 cases are between 40 and 59, and 2 are over the age of 60. Of the 45 people to have tested positive for the virus yesterday, 20 were already hospitalized, 21 were in isolation centers, 2 were in centers for suspected cases, and 2 people were diagnosed in their homes. Of the 45 autochthonous cases diagnosed yesterday, 30 belong to Havana, 12 to Ciego de Ávila, and 3 to Matanzas. The 30 cases from Havana belong to the municipalities of Centro Habana with 5, Cotorro with 4, La Lisa 4, Arroyo Naranjo 4, San Miguel with 3, Boyeros and 10 de Octubre with 2 each, and Plaza, Guanabacoa, Habana Vieja, Cerro, Habana del Este, and Playa with 1 case each. The 3 diagnosed cases in Matanzas belong to the municipalities of Matanzas, Cárdenas, and Limonar, all with 1 case each. The 12 cases from Ciego de Ávila belong to the municipalities of Ciego de Ávila with 9, Venezuela with 2, and 1 case to the municipality of Morón. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 53.31. Havana follows with 19.25, then Matanzas with 10.42. Sancti Spiritus has 6.87, Artemisa 3.88, Mayabeque 3.38, Camagüey 1.18, and Holguín with 0.29. Meanwhile, Cienfuegos, Pinar del Río, Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have reported no new cases over the last 15 days. Some of these provinces have reported no new cases for several weeks, and others none over the last few months. Cuba's confirmed case rate per 100,000 inhabitants over the last 15 days therefore stands at 7.11. To summarize, of the 5,457 people who have been diagnosed with the virus thus far in Cuba, 582, or 10.6%, are active hospitalized cases. Of these, 575, or 98.7%, are clinically stable. Yesterday, 2 people died as a result of the virus, meaning that the COVID-19 death toll on the island rises to 122, with a mortality rate of 2.23%, lower than the global rate of 3.03% and the regional rate of 3.36%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 19 people were discharged from hospital, a negative result when compared with the number of confirmed cases diagnosed yesterday. This means that, to date, 4,751 people, or 87.1% of all confirmed cases in Cuba, have recovered from the virus. Today, 3 patients being treated in hospitals in Camagüey and Matanzas continue to be in a critical state. 4 patients in hospitals in Havana and Camagüey are also reported as serious. Yesterday, 1 patient joined the group of those reported as serious. 1 serious patient passed to critical, and another passed from serious to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 324,772 people were diagnosed with the virus, for a total of 32,613,844 confirmed cases since the start of the pandemic. Yesterday, 5,688 people died of the virus worldwide, for a total of 989,728 COVID-19 fatalities, and a mortality rate of 3.03%. The region of the Americas, which currently accounts for 49.93% of all cases worldwide, reported 131,668 new cases yesterday, for a total of 16,285,399 people to have been diagnosed with the virus. Meanwhile, 3,071 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 547,872, and a mortality rate of 3.36%. The United States continues to top the list of countries worst affected by the pandemic, with 7,033,430 confirmed cases. India has 903,932. Brazil registers 4,689,613. And Russia has 1,136,048 confirmed cases. From the Americas, after the United States and Brazil, comes Colombia, Peru, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, the Dominican Republic, Panama, Guatemala, and Honduras. These are the countries with the highest number of cases in the region. Cuba occupies 21st place on this list. Regarding mortality rates, Mexico has the highest, with 10.52%, followed by Ecuador with 8.48%, Canada with 6.15%, and Bolivia with 5.35%. This is the information we have on the behavior of the pandemic in Cuba and the world.